Hello and welcome back to another episode of Tea and the Tales. I'm here today with Dr. Snezhana to discuss all things pet dermatology. So why is your pet itching? It's a question so many people ask. So just to give us a little introduction about yourself, Snezhana, can you tell us why you're here today?
My name is Dr. Snezhana. I'm from Russia. So I've been with Modern Vet for 2.5, I think, years already. I was studied in Russia. I graduated Kazan State Academy of Veterinary Medicine. And I have special interest in dermatology. So I studied in dermatology school. Yeah.
What is it about dermatology that kind of interested you?
That's an interesting question, actually, why I love dermatology. Maybe because I really love both pets and owners. I like to build relationship, and most of dermatology patients, they are
Like an ongoing
ongoing, especially if we are talking about allergies. So it's not a curable disease, but we perfectly can manage it. And I see these patients within all their life. I know the clients, we have a relationship, and I really like it. And I like to see them happier, more beautiful.
So can you tell us a little bit about what are the common causes of itching in cats and dogs, like the top kind of things that you see regularly in the clinic?
So if we are talking about Dubai, it will be a bit different than my previous experience back in Russia, because we have some specific diseases here, or we don't have some type of allergies here, for example. And
which ones would you see here that you wouldn't see in Russia? Or like what are the big differences?
For example, in Dubai, I almost do not deal with flea bite hypersensitivity, but it's very common in Europe, back in Russia, and in many countries. But here we don't have it. But we have a lot of atopic dermatitis dogs.
This is a big myth or question in Dubai. Are there fleas in Dubai, or it's just very rare? I would like to settle this.
Very rare, I would say. For my 4.5 years in Dubai right now, I've seen fleas 2 times.
I've only seen it once, yeah.
Once on a dog and once on a cat.
Okay, so they can get it. It's just rare. Okay.
Very rare. So if we are going back to the reason of itching, the first that we have to mention is parasitic diseases and infections. It might be bacterial infection that are usually secondary to primary disease.
Okay.
So it's not only bacterial infection that we have to treat, we have to find the primary cause of it. It might be fungal infections, and the most common, I think, is dermatophytosis, or well known as a ringworm.
Okay.
It still can be very itchy on both dogs and cats. Of course, allergies, and we have to remember that we have different type of allergies and not only food. Autoimmune diseases can be sometimes itchy, especially again when secondary infection is involved. What else?
So how do owners know, is it normal amount of scratching or not? Like if the pet is scratching their ears, scratching their body, how do they differentiate? It's just the normal kind of, he has a scratch, or okay, I need to bring him in. Like what should owners look for to know about it?
Of course, every pet can scratch a little bit, and it's normal. And don't forget that cats especially, they might just lick themselves, and they really, like, they groom themselves, and it's normally,
they spend the day doing it.
Over grooming, when they groom too much, when they start losing hair because of over grooming, this is not normal. And this is something special for cats, if we are talking about both. What else? Like when the pet is itching too much and they start losing hair, having bald patches, having some rashes, pimples, how they like to call it, lumps, something like this, like something abnormal, and the pet doesn't look the same.
Question as well, I see it a lot on Instagram. People always worried about their cats, acne they call it, the little black spots on their chin. Should people be worried about this, or it's a normal part of having a cat?
It depends on, I would say. If, for example, it's just a small amount of black dots and it doesn't bother cat at all, maybe don't do anything. If it becomes a little bit more and we see a lot, or the cat is scratching this area, it's better to be seen by the doctor, because acne might be just cosmetic problem,
Mm.
or it might have underlying cause, like, for example, feline dermatitis caused by specific Demodex cati, because they have two types of these parasites,
Okay.
or it might be caused by ringworm as well. And this underlying cause, of course, has to be detected and treated if they have it. Or if there is acne, like black dots, but plus like some pimples, furuncles, that might happen.
Okay. And can you tell us as well the most prone breeds, maybe in cats and dogs, that are prone to allergies or skin problems? Like, as you see in the clinic, which breeds keep coming back for the skin problems?
Among cats, I think I will name Persian cats.
Okay.
They are predisposed to dermatophytosis, ringworm, and they might have very complicated type of ringworm when it's not only epidermis and hair, when it goes under the skin, so it like cause deep tumor-like lesions.
Okay.
And among dogs, I think I will cause brachycephalic breeds, because due to their anatomic structure, they have a lot of folds, skin folds, that will be inflamed more frequently. But again, even French and English bulldog might be absolutely normal, even having a lot of folds without any inflammation, if there is no underlying cause for that.
Yeah. And then, so how do you differentiate between allergies and parasites in itchy pets? What's the process?
Well, the process for the first and the main thing for us is the history. So I like to talk. I like to talk with my clients and to gather all information about the pet, about lifestyle, about food, about other pets at home. Everything will make sense. So then, of course, clinical examination. And when I combine two things together, what I have as an information and how it looks like, I will already have some differential diagnosis, like certain amount of diseases that I will have to think about. And then I will go, okay, if, for example, I have this type of parasite, like random patient, and I'm thinking about dermatocauses as a reason of his symptoms, and, for example, bacterial infection, pyoderma, we call it. So I know that for that I have to take deep scraping or trichoscopy and cytology sample. So based on my differential diagnosis, I will choose what type of test I'm gonna do. Usually I perform it immediately. It will take like 10 minutes to take the sample, to stain it, to go and check under the microscope. And I will either narrow down my diagnosis or I will already find the reason.
That's what I really like about dermatology. It's such a little jigsaw of like, you take from this, then you're kind of figuring out all the pieces that go together to get the diagnosis. It's very interesting, I think, to see. And then you kind of spoke about it earlier. Can food cause allergies in pets, or is it a common thing that you see that they have the allergies?
Yeah, of course it can. Unfortunately, it's like very kind of complicated, because what I noticed usually when I'm having an itchy pet and the owner comes to me, they immediately say, my pet is itchy, my pet is itchy, it has some lesions, but we didn't give anything new. But this is the main thing. For the first, food allergy is not for something new. For the allergen to become an allergen, it has to persist in life. And for the second, food allergy is not the only one allergy, and it's quite rare allergy comparing with environmental allergy. But still, no any simple test that will show us what type of allergy we have. It's also a bit not so easy.
What's your opinion on these tests where they do the breakdown of all the different kind of allergens?
You are talking about blood test, no?
The one where they do the patches.
Patches, it's intradermal skin test. Actually, it was created and it has to be used only for the patient that already proved that have atopic dermatitis, environmental allergy.
Okay.
Maybe you asked me about patches like with a piece of food
Mm-hmm.
type, placing on the skin and holding it for some time.
Yeah, it's the one where they come back with the list of allergens.
But there is different type of this test. So we have skin intradermal test and we have blood test where we check immunoglobulin E level.
Mm-hmm.
So if we're talking about skin intradermal test, it's for atopic dermatitis or airborne allergens, and we inject small amount of allergens. But the main thing, it has to be created exactly for the region, like for Middle East region, for example.
Yeah.
And we see the reaction, but it's not related to food because the main goal of this test is to understand what type of allergens the dog has and then sensibilize it, like to prepare the vaccine to teach immune system to tolerate the allergen. This is the main reason of that test, is not just for detection. Because what we're going to do if we know that the dog has allergy for dust mites, even if we clean our apartment perfectly, we will not able to remove it completely.
Exactly. That's what a lot of people kind of said with this test. Like, what are you going to be able to do with that result then? Like, okay, he's allergic to the pollen on the trees that's very common outside. Now what's your next step? That's another question, actually. Year-round allergies compared to seasonal allergies. Do you see that, I don't know what season that would be in Dubai, that people start to have these kind of seasonal allergies?
You know, in Dubai, there is no researches. Let's say in Middle East, generally not so many researches. So, but by my experience, I didn't notice yet any seasonal allergies. I think because we have the same season all the time. And, but yeah, it makes sense for European countries because there is autumn where we have a lot of rain and it will cause flare up of dogs with an allergy for mold, for example.
Yeah, or in the spring, like the pollen. Yeah.
But yes, here I don't see much different. Well, maybe it's not enough time for me. In 5 years, I will have more like experience with different
really
seasons.
Yes,
if there is something.
And what's your opinion then on over-the-counter medications or shampoos and supplements? Do you find them helpful?
They will not solve the problem completely, but of course they're helpful. Plus, there is a lot of shampoos, like we call it medicated shampoos here. But they have, like, for example, chlorhexidine, which is very good antimicrobial. But again, you have to know where to use it because it make dry up the skin too
If
much.
you have let's say you have a pet that doesn't have allergies or hasn't been diagnosed with allergies, and you start to use these kind of medicated shampoos, is that recommended, or in this case it's too strong for your
it will dry up the skin, and then the dog will become itchy just because of the dry skin. So
you need to follow your advice.
maybe not necessary. But supplements, there's not so many supplements for skin, to be honest. Maybe just omega,
the fish oils,
fish oil, yes. But it will not like make hair grow. It will just make it more shiny and more beautiful, but will not
it's not
help
a fix
growing.
for an actual problem. Yeah, fair enough. And how do you feel then about long-term use of steroids? Again, when trying to like fix an allergy problem or an itching problem.
Okay, if we are talking, for example, about itchy pets and steroids as a treatment, and we have to separate again cats and dogs because cats, they do not have any other solution. I mean, they have steroids and cyclosporin only, and that's it for now. Oclacitinib or Apoquel, that became so famous for dogs, it's still off-label for cats. But some cats, yes, we have to use steroids and we don't have any option. Plus, some cats, they will not able to take tablets. Like, it's super complicated.
I think it's every owner's like worst nightmare if you say to them, like, take this tablet twice a day for the next 10 years, for something, and the cat is really not taking the medication that easily.
But we're always trying to find a way because tablets will be a priority for me as it has short action and we can avoid side effects or can prevent them or can help when it really happens, when really something happened, and like we can manage it. So for cats, yes. And cats are more tolerated, I think, to steroids. Not I think, like they do not develop side effects so quickly as dogs.
Yeah.
If we are talking about dogs, sometimes I really will use steroids because there is no any other option right now without clinical symptoms. And sometimes I use it at the beginning of the treatment, just to booster, to help, or to use side effect of steroids, like for example, when the skin is too thick due to chronic inflammation, steroids will help faster, will make it thinner. And then in a couple weeks, I will switch to another treatment if we're talking about dogs. We have oclacitinib, we have Cytopoint right now.
Yeah, that was my next question. Thinking of like new treatment options. What's your opinion on Cytopoint?
I love Cytopoint. I just recently started using it because I didn't have ideal patients for that.
What would be an ideal patient then?
Ideal patient is the dog that has itching without inflammation of the skin.
Okay, and how do you differentiate between the inflammation?
Yeah, because Cytopoint doesn't have anti-inflammatory action. It has very good anti-pruritus, anti-itching, but very low anti-inflammatory, almost nothing. And for example, for that patient, if I have like typical allergic dog with secondary infections, I will go for prednisolone or oclacitinib first with antibiotic or antifungal, depending on what we have on the skin. And when the dog looks perfectly fine, then I will go for Cytopoint only. So I will prepare this patient for Cytopoint.
Okay.
Or I have some dogs, for example, they're super itchy. They're like pulling down piece of their hair from their body, but skin looks absolutely normal. Or just like a bit reddish, but without yellowish crust, without signs of inflammation. And of course, I can take always cytology and prove that the skin is good for that. And also, if allergic dog has ear infection as a symptom,
okay,
Cytopoint will not be able to cover it by itself.
Yeah.
Always, when we do have ear infection as a one or the only one symptom of an allergy, we go with local treatment. Does not matter, prednisolone might be better, but trying to not use prednisolone as a long term with dogs.
Okay.
Because they have other options, safer options.
Yeah. What's your opinion then on, there's a few different versions about food. We spoke about it earlier, but people kind of going by grain-free diet or novel protein diet. How, do you implement this often into your treatments?
Almost with every allergic patient. Like, for example, I have an itchy patient and I already proved that there is no parasitic diseases, there is no fungal diseases, etc. And we put into the plan food, changing the food, because this is still the gold standard of diagnosis food allergy. So to understand if it's food or not food-related allergy, the diet with novel protein or hydrolyzed protein diet, this is the gold standard.
And just to explain to people by novel protein what we mean.
Novel protein means that some type of meat that the dog or cat have never eaten before.
Yeah. So I know a lot of dogs would be allergic to chicken, or this is kind of the thing that a lot of people are feeding the dogs that.
Yeah. So most likely it's just because this is the most common
one. Yeah.
protein that we use in our food and in pets' food. Not only chicken, beef actually as well, because this is two type of proteins that are normally used in all food.
And nowadays, in the last year or two, I see it a lot more, like insect protein. Have you seen this one?
I've seen it. Remember, we were working with one brand and now it disappeared from Dubai, from the UAE.
Yeah, a year or two ago, the insect protein I feel like was more...
I liked it. Yeah. I liked it because it was very good palatable. I mean, dogs liked it.
Yeah, they did.
And it was quite good. Why? Because it's, of course, absolutely new source of protein for all dogs, actually.
Exactly.
And this brand, I mean, if they have insect protein food, they have only that type of protein. in the factory. They don't use anything else. So
Mm.
that's why it should be quite
Very
clean. Yeah.
hypoallergenic. Yeah. Okay. So what are simple things owners can start to implement at home if they see their pet itching?
What they have to or
Simple
they
things
can.
they can try to do, or is it always come to the vet first?
If
Or-
it's severe itching, of course, because sometimes it's like,
Yeah.
especially
Let
with
me
cats.
reword it then. Things around the home people could probably not be aware of, maybe that they have around their home that could be causing itching. So it's not to try and treat it at home, but things around the home like this incense and these like kind of irritants that people could be doing, like burning candles. Like, do you often tell people to kind of, you need to modify your home a little bit? Like there can be a lot of allergens in the house.
Mhm. I got it. You know, about allergy, I don't think that we can prevent something because all this candles and something, as you said, they might cause other type of allergy, going with sneezing, coughing, something like this. But about skin, it will not make sense. But I would say, for example, if the dog visits dog park, daycare, like places where a lot of different dogs, or they go to stable, for example, or to the desert,
Yeah.
better to use some medicines for preventing parasitic diseases like spot on drops, tablets for external parasites, we call it. It might be different type of medicines, but yeah, it's better to use if the pet is often spend time with others.
That was my next question. What should people, if their pet is indoor, like a cat or it's mainly indoor dog, do they still need to take this kind of preventative parasitic medication?
I don't do that, and I don't recommend my pet owners to do that. If they are just indoor, they don't go outside. Not necessary. Internal, yes, we still have to do that, but external, I don't think that it's needed if they live just indoor.
Fair enough. And when should people know to see a vet dermatologist or just a general vet? What kind of conditions is it better to kind of be seeing someone who's really more specialized into the vet dermatology?
You know, if it's something like something simple, I would say, where like the owner is just worried, but it's just started and he wants to check, yeah, he can go to regular vet, I would say. Or if, for example, the itching is acute, like the cat might start scratching till bleeding and like they're really crazy in that. It means that it's kind of an emergency and we have to visit any doctor to stop these symptoms do not cause much problems for an animal. And but yeah, if the case is more complicated or you have time and like you can visit dermatology, it's better because you will see. And sometimes I cannot find the problem right now on the consult, but in that with some diseases, but we'll make a plan for the future. And I always educate my clients what to do if something happened like this, or like we have a plan of treatment, but if happens like this, what do we have to do? If things go in another way, what do we have to do?
It's nice to prepare them kind of like from all the possible outcomes. And do you find that, because I know with dermatology, a lot of the plans, like you said, it's kind of like long-term plans. Do you find it's an issue with like owner compliance? Or I know for when you're doing the trial food, for instance, do you find an issue of like, yeah, we've been feeding him the food plus, you know, some snacks, you know?
We discuss it. That's why not in 100% cases I will go for food diet at the beginning, because we discuss many things like traveling, having grandma as a
is she
guest.
visiting? Is she going to be feeding your dog every day? Yeah.
Because it will be like useless time. We will spend money for food, or we will switch the diet, and especially it's difficult for cats. They are not ready to eat something new.
Yeah, they're picky.
That's why we discuss all these things, and sometimes we even skip this step and go for, if it's about allergy dogs or cats, we go directly to atopic dermatitis treatment, considering not having food allergy if diet is not possible at all. Sometimes it might happen. Some cats or some dogs can reject any food, or there is like, for example, 5 more cats, another cat on specific diet
and the
that
kidney
cannot
food
be
and this
changed.
one's-
Yes. and it will not be possible to separate them. Especially with cats, it's difficult because they eat more frequently
Yeah.
than dogs. So in that case, yeah, it's all depend on situation.
Okay, and then a final question. Can you let us know some of the biggest myths you want to dispel when you're talking about veterinary dermatology? Like these myths people kind of keep coming back with. They have this idea like turmeric, let's say, for the skin. Like I've seen a few people like bathing the dogs in turmeric and the dog becomes orange even. Something like this where you see like you want to kind of dispel any myths that you often hear.
No, I think the main myth is chicken allergy, because I hear it like,
Yeah.
and it doesn't depend on the country. Actually, it's everywhere. Chicken is poor chicken.
Yeah,
Always
everyone's
the-
dogs are.
always the reason of something, but yeah, chicken can't be safe. It's not the only one reason of itching.
Fair enough. And for owners looking to find more information, can you advise them where they can find more information about itching, or what should they do if their pet is itching?
Better to take advice of your vet, I
Yeah.
think, because now we have not only Google, we have ChatGPT.
Yeah.
And as one of the youngest client, was 2 girls, like 10 years old. They came with a cat to me for vaccination, actually. And she said, oh, we noticed something on his ear. I asked ChatGPT. He told me it's just insect bite. That
What
was
it?
ringworm. And she
She
said,
came in with him like holding.
she said, I will never trust ChatGPT again.
But there you have it. It's definitely better to ask your vet always. Thank you so much for speaking with us today, Dr. Snezhana. That was so helpful, I'm sure, for so many people as well.
Thank you. Thank you for having me today.
It was so loud outside. The door like this.
I was literally
Who was
I
pooping?
didn't want to look at you because I was like already crying.
I'm almost crying there,